The Western Cape government says 385 health workers have been vaccinated for COVID-19 in the province, or rather had been vaccinated by Thursday afternoon. The program continued into the weekend. Today, the first group of doctors will get their vaccines at the Groote Schuur hospital. The facility hopes to vaccinate 250 doctors today. Our colleague Vanessa Poonah is at the hospital. Let's cross live to her now. Very good morning to you, Vanessa. What have you observed already? Has the vaccination process started for the doctors?
Yes, a very warm good morning to you, and we are standing here at Groote Schuur Hospital, of course, where this morning private GPs are lining up literally to get their jabs here at this hospital. I know that over the past few days, just yesterday, for example, at both the Tygerberg as well as Groote Schuur sites, of course, the vaccination sites, just over 800 vaccinations have already taken place of healthcare workers. And I'm joined by Dr. Sadiq Karim, who's the Chief Operations for the Western Cape Department of Health. Doctor, very warm good morning to you. We see sense excitement here, yes, as private GPs are lining up. Doctor, talk to us a bit about how far since the vaccinations arrived in the country. 13,000 of them here dispatched to the Western Cape. We've seen the President among the first group being vaccinated in Khayelitsha last week. Where are we standing at this present time in terms of the numbers in the private sector as we see doctors gathering outside here today?
Yeah, so first of all, this is a really momentous and yet another milestone event for the province. We started yesterday, in fact. So yesterday we did the private sector hospital groups, and today we're doing the private sector GPs. As you said, yesterday we've done 862 vaccinations between Groote Schuur and Tygerberg site, and today we hope to cover between 500 and around 550 vaccinations of private GPs in the province. And they've come from far and wide to come to Groote Schuur and Tygerberg to get their vaccinations.
Doctor, in terms of the registration process, that would have been communicated before. Is there an indication? We know that initially, and even on a national level, there's been a sort of, I don't know if one can call it still, reluctance in terms of the number of people, healthcare workers, etc., that had actually registered. What is it looking like in the Western Cape? Is it on par with what we've seen happening nationally? Where is the buy-in at this point?
Sure. So we know that we did a study in the province amongst our own staff, and we found that at least 20% of our own healthcare workers in the Provincial Department of Health said that they're not prepared to take the vaccine. But that number we hope will dwindle as people see the process unfolding in the province, and we're hoping obviously that people will be convinced to take the vaccination. In terms of registration, there is a national system, an electronic system for people to register. They get confirmation of their registration, and then they get told where to come and when to come for the vaccination, and that's part of the process that we've done. We do have also a paper-based system, so that if that is not up and running, we can also default to our paper-based system.
So, Doctor, I understand that the target today between the two sites here and Groote Schuur is something like 500.
Yes.
How many vaccinations should then take place on an hourly basis to get through those numbers today?
Yeah, so it depends obviously on the number of staff and vaccinators. We try to get through on this site, for example, 33 vaccinations an hour. And obviously if we run ahead of schedule because we've got extra vaccinators, then we run ahead of schedule. But on average it's been about 33 vaccinations. But as the day picks up, we'll find that we'll able to increase that total as the vaccines thaw and as they come on site, and we can inject our colleagues.
So with things looking as though they are progressing quite smoothly in terms of getting the first phase, at least with the numbers of vaccines we do have in this province underway, how soon before we have completed our 13,000 quota and ready for the next batch coming?
Oh, a difficult one to put a definitive time frame to that. Look, we're aiming at this stage to at least reach 1,000 to 1,500 per day, and then scale it up from there to obviously as much as we can. Next week we'll bring online in the province another provincial public sector site for vaccination, and pretty soon I understand that the private hospitals will themselves have additional vaccination centres. So the more vaccination centres as they come online, we'll obviously be able to increase the quantum of people vaccinated. But for now, we wanted to send the right message that we started the vaccination of the private sector, and because Groote Schuur and Tygerberg are the only two registered sites, we've arranged with our colleagues and many days of planning ahead of schedule to be able to not have complete chaos. So we've got lists of people who are coming today and who we expect, and they will get their jabs. And so we've been working very well with the private sector in the province.
Thank you so much, Dr. Karim. We will certainly join you inside in a short while just to see how that process unfolds. And so at this point, thank you very much, Dr. Sadi Karim, there, of course, from the Western Cape Health Department, just giving us some sort of idea of how this day will be progressing, and also the numbers of healthcare workers, both in the public as well as private sectors, that would have at this point already received their vaccinations at the two registered sites, being Groote Schuur Hospital, that's the site where you are currently, and also at Tygerberg, the second site here in the Western Cape.
Thank you so much, Vanessa Poonah, there bringing us up to speed in terms of the vaccination rollout story.